In this lesson, we will be discussing constipation, a common gastrointestinal condition. Constipation is a symptom that has different meanings to different people, since different people have different patterns of bowel movement. Constipation could include infrequent bowel movements, generally fewer than 3 bowel movements per week. Stools that are hard, dry, or lumpy. Stools that are difficult to or painful to pass, where the person needs to strain to have a bowel movement, or a feeling that not all stool has passed. Constipation is not a disease in itself. It's a symptom that can result from many different underlying problems. When a patient presents with constipation, we need to think about what might be causing it. Common causes include lifestyle factors like insufficient fiber in the diet or lack of physical activity. Changes in routine such as traveling can disrupt bowel habits. Some people develop constipation simply from ignoring the urge to have a bowel movement, perhaps due to busy schedules or avoiding public toilets. Certain physiological states can increase the risk of constipation. Pregnancy due to hormonal changes, aging due to decreased mobility, and dehydration which causes more water to be absorbed from the large intestines. Laxative abuse is an important cause to mention. Regular use of stimulant laxatives can lead to dependence, where the bowel becomes lazy and will not work properly without them. Specific diseases or conditions can lead to constipation. For example, problems with the colon and rectum, and neurological conditions such as stroke and Parkinson's disease. Medications are another major cause, for example, opioid painkillers and iron supplements. When it comes to treating constipation, we need to think both short-term and long-term. Laxatives can provide quick relief, but they are really just a short-term solution. For long-term prevention, we need to focus on lifestyle modifications. This means increasing dietary fiber through fresh fruits and vegetables, ensuring adequate water intake, and maintaining regular exercise. These changes might take longer to show results, but they are more sustainable and healthier in the long run. There are 4 main categories of laxatives that we will discuss: irritant or stimulant laxatives, bulk laxatives, stool softeners, and osmotic laxatives. Let's start with irritant or stimulant laxatives. These are powerful medications that work directly on the intestinal wall to stimulate strong peristaltic movements. Common examples include bisacodyl, which you might know as Dulcolax, and Senna, so as Senokot. Stimulant laxatives are available in both oral and rectal formulations. These medications come with several side effects. They commonly cause abdominal cramps, and this is actually related to how they work by stimulating intestinal contractions. Patients might also experience diarrhea if they take too much. Nausea and belching are other common side effects that can be quite uncomfortable. Here's an important precaution. These laxatives can be habit-forming. Long-term use can lead to dependence, where the bowel becomes lazy and will not work properly without the stimulant. This actually makes the constipation worse in the long run. That's why we typically recommend this for short-term use only. Bulk laxatives work more naturally by mimicking how fiber works in our diet. They contain indigestible dietary fibers that absorb water in the intestines, creating a soft, bulky stool that's easier to pass. Common examples include psyllium, a brand named Metamucil, and Aspergillus Has in the brand Fibrogel. For administration, patients need to mix the powder in a glass of water or fruit juice and drink it immediately. If they wait too long, it forms a thick gel that's difficult to drink. They should also follow it with another full glass of water. This extra fluid is essential because these agents need water to work properly. One caution: this can sometimes cause abdominal pain and bloating. They should not be used if bowel obstruction is suspected. Because bulk laxatives are generally very safe, they are used as the first line of treatment if there is constipation in pregnancy. Stool softeners work differently. They are emulsifiers that help mix fat into the water in the stool, making it softer and easier to pass. The main examples are Docusate, brand name Surfact, and liquid paraffin, brand name Agarol. This image here shows a bottle of liquid paraffin, but not brand name Agarol. This is a generic version. With liquid paraffin, patients may experience anal seepage of paraffin, which means the paraffin comes out through the anus, and this can be quite uncomfortable and embarrassing. With prolonged use, they might also develop anal irritation. Liquid paraffin is usually taken in the evening, but patients should not take them immediately before going to bed. This is to avoid aspirations, which means accidentally breathing in the liquid paraffin, which can cause serious lung problems. Osmotic laxatives draw water from surrounding tissues into the stools through osmosis. This softens the stools and makes them easier to pass. They are particularly useful in elderly patients and those with opioid-induced constipation. Common examples include lactulose, which you may know as Dufalac, phosphate salts like feed enema, glycerin suppositories, and polyethylene glycol or PEG solutions. Each of these works slightly differently, but they all rely on the basic principle of drawing water into the bowel. However, these medications are not without side effects. Patients often experience abdominal distension and flatulence, particularly with lactulose. With salt-based laxatives like phosphate preparations, we need to be careful about electrolyte disturbances, especially in elderly patients or those with kidney problems. It's important for us to know how quickly different laxatives work. This is crucial information for counseling patients and managing their expectations. Fleet enema is a liquid that is inserted into the rectum, and this works the fastest, within 2 to 15 minutes. It's important for the patient to stay close to the toilet after using it. Stimulant laxatives in suppository form are inserted into the rectum, and they also work very quickly, usually within 15 minutes to an hour. Stimulant laxatives in oral form take about 6 to 12 hours to work. This is why we recommend taking them at bedtime to have a morning bowel movement. Some osmotic laxatives, such as saline laxatives, work quite quickly, within 30 minutes to 3 hours. Stool softeners take about 6 to 8 hours to work, and thus are often taken in the evening to produce results the next morning. Lactulose usually takes 1 to 2 days to show effect. Bulk-forming laxatives work more slowly, usually taking 2 to 3 days to reach the full effect. They need to be taken consistently and with plenty of water for best results. You are not expected to memorize the exact timings, but it is important to have a general idea so that we can advise patients when to take the medication and when they can expect to see results. Let's summarize what we have learned about constipation. First, remember that constipation is a symptom, not a disease. The causes fall into several categories, such as lifestyle factors, physiological states, medical conditions, and medications. For management of constipation, always start with lifestyle modifications. When laxatives are needed, we have 4 main types: stimulant laxatives, bulk laxatives, stool softeners, and osmotic laxatives.